I'm going to go back to one point that I wanted to touch on. I completely forgot, actually. And how would you go about asking a transgender patient about their sexual health?
The issues that come surrounding a sexual history for a transgender patient is actually the dysphoria that you can cause the patient, because they will have their own words that they use to make themselves not feel better, but feel less dysphoric about that area. Having sat there in that seat, taking a sexual history is so awkward, so awkward.
Hi everyone and welcome to Conversation with Vassili. I am Vassili and I'm really excited for this very first episode to welcome my friend and colleague Will, who's going to introduce himself. Hi Will.
Hi, so my name's Will. I'm a fourth year medical student currently and I want to go into transgender healthcare.
Amazing. So as I'm sure you would have already guessed, we're talking about transgender care today. And we need to break the ice to begin with. Can you tell me a little bit more about yourself? And then we're going to go for some quick fire questions.
Yeah, so I'm currently 22 and I'm also a transgender man. I've now been transitioning for just over a year and a half. And things that I like to do include like drawing and also listening to music.
Amazing. Okay, so 5 questions. Please answer with the first thing that comes to mind, okay? Honesty will be perfect. So, who is your favorite superhero and why?
Captain America. He went for a giant transition just from being the tiny man that he was to the big man that he is now. And I have always really relished in that information for some reason. So take what you wish.
Amazing, great. So question number 2. What's your spirit animal?
Oh, it's probably something like a wolf because it'll keep in a pack, and I like being with lots of people, but also they can go off by themselves and still be quite proficient.
Okay, so do you feel like you're quite close with your team, with your friends, with your family? Is that probably why? Okay, amazing. So, question number 3. What's the color of your toothbrush? And please feel free to tell everyone your toothbrush history.
So currently I have bamboo toothbrush, gotta save the world, but the toothbrush history is I used to have one with a suction cup on that my girlfriend used to hide around the bathroom, and there was places where it was above the shower, on the toilet seat, it went everywhere.
I had such a great time as I just waking up every day as like on Twitter seeing where it was hidden the next time. That was quite entertaining. Totally people go and check it out. And okay, so question number 4. Would you rather have arms for legs or legs for arms?
Probably arms for legs. I'd do amazing cartwheels all the time, and also it'd be nice to have extra pair of hands.
Oh, I love it. I'm exactly the same as I can't do as like need to be able to type and write. Okay, so last, if you could buy any food right now, any food whatsoever, what would it be?
Probably a veggie burger from Weatherspoons, just because I miss them so much.
Are you vegetarian?
I am vegetarian.
Oh, I've learned something about you. There you go. Fantastic. Okay, so I hope that has kind of broken the ice, so we're back into it. Are you happy to tell us a little bit more about your transgender journey?
Yeah, so it all started quite a long time ago. I was that kid that was always like quite tomboyish, and I never wanted to wear a dress, and I was always muddy and climbing trees. And my parents were always like, "Oh, she'll grow out of it," and I just never did. And when I got into my early teens, I started questioning, "Oh, am I a lesbian or am I trans?" And I think quite a lot of people do go through that, trying to understand what their gender is and how their gender differs from their sexuality. And by the time I came to uni, I still wasn't out as trans and I still was querying it. So I tried to do things such as join a more masculine sport. So I joined rugby to see if that would make me feel better, to be surrounded by empowering women. I still felt the same. I tried to go hyper feminine and try to push myself into a more feminine role, and that didn't work either. And I got to the point where I got very low in my own mental health because I wasn't accepting what I knew I actually was. And by accepting myself, I automatically felt a lot better. But then at my start of my transgender journey, I went through a lot of different name changes, as I'm sure a lot of people do, and I'm so glad that I chose the name that I did with William, because some were like Casper, and I was getting jokes like about the friendly ghost, and it just wasn't great. But it was really nice. When I came out to my family, they were amazing, which I'm so thankful for. The only thing that actually did happen was my mum cried, but that's because she bought me a present with my old name on it. And it was just quite funny. It's quite funny to look back on now. Yeah, and then I was lucky enough to start my hormones about a year and a half ago. So I've luckily gone through the changes of my body changing shape. I've lowered my voice. But it's never nice going through a second puberty. You get the acne again, you get the mood swings. And I'm currently sat in my like waiting period, which I probably think would be another 2 years before I can get any forms of surgery. But I'm just living life to the fullest at the minute and enjoying not being misgendered as often as I used to be. And yeah, I'm finally in a good place with it, if you put it that way.
Yeah, no, it sounds really, it sounds like a more positive journey now, isn't it? And you kind of
definitely.
You mentioned about your mental health, and I guess it can be quite tough, especially at the very beginning. Do you feel like being able to actually access the service has helped you?
So it's a difficult one, because I was lucky enough to have raised some money to actually go privately for some of my treatments. So I went privately for my hormones, whereas the NHS clinics actually now, due to COVID as well as the long waiting times anyway, if you were a third state, you'd have over a 5-year wait to get most forms of treatment. So it's very difficult in terms of that. I happened to be in an fortunate position that I had enough money to go privately for my hormones, and that my GP would allow me to do that. But that definitely did help me, and I'm sure that other people can agree that waiting for the clinics is a very difficult thing to do.
Absolutely. And I know that, I mean, the wait is already long enough in itself, and sometimes you don't get the service you were hoping for to begin with, but now COVID has even made it even worse, because everything is delayed and it's backlog, isn't it? Okay. So what kind of challenges have you faced? And they don't have to be related to your journey, or is just in general in healthcare?
So one challenge that I did face was actually getting into medical school. So I lived in quite a deprived area when I was growing up, and the schools that I went to weren't the best. They didn't have great Ofsted ratings. They were always under improvement. And when I came out with my GCSE results, they were amazing for me. They were just high enough to get me into the college that I wanted. But when you compared them to the rest of the town or the city that I lived in, they were actually quite low. But I got the highest in the school, so it was quite a surprise. Thank you. I went to then like quite a nice college that really helped, but I struggled with my own mental health yet again, trying to get the results to get into med school, and lucky enough I did. But that was a whole I think the best way to say is just a stressful situation trying to get into med school for me. And then I hear others that get into it just by like, oh yeah, like my A levels are easy, and I'm like, sure.
Good for you.
Yeah.
I think getting in was probably the hardest part. I think staying in has also been difficult, but that's just because of what's happened to me, really, with obviously transitioning into my own mental health. But yeah.
Am I okay to ask you? It's okay if not. What kind of challenges? What has it been like studying medicine and going through your journey?
Yeah, no, that's fine. It can be difficult at times. I remember when I came out in my first year of university, so 4 years later. It's much better now than it was at the beginning, but having to say halfway through my first year of medical school, by the way, I'm trans, I don't go by the name that I used to do, was very difficult, because if I'd done that 6 months earlier, everything would have been fine. So I'd had meeting after meeting with higher ups within the medical school. Everyone now knows my name, but that's not the point. Just to explain that, look, all the staff need to know, all the students need to know, but I also don't want to be in the forefront. I don't want you to stand me up on a stage and pinpoint me, which is difficult from both mine and from an admin perspective. I think one of the most difficult things is that our emails are obviously HY for the medical school, and then our initials, and my initials are still my original initials, so they're still JB, whereas obviously I'm WB now, and that's just something that the medical school couldn't change because of how our whole profiles within the medical school is set up. So that's been quite difficult every day, having to log on and see my old initials. At least it's not my old name, but still, it can be difficult at times. From both, I imagine like medical staff get frustrated as well because they will still type my email in with my initials that they know me as, and then I have to explain, oh no, that's not my email, and they're like, wait, what?
Okay.
Yeah.
And like I know we see so many adverts. I think Starbucks used one with a transgender man for ordering like some orders, and they played along the line of mistaking their name, wasn't it? Do you feel like that actually happens a lot in healthcare as you go through or at any point?
Yeah, definitely. I've had situations where I've had to explain to doctors multiple times that I am a he. Can you please call me a he? And these can be from someone that's a foundation doctor where they've had absolutely no idea and they're so apologetic, to a consultant that's just been like, oh, I had no idea. And I was like, yeah, or so that was quite early on. Whereas now I have to be very careful about if I am going to tell a medical professional, doesn't matter if they're a doctor, nurse, midwife, whoever, that I am transgender, or that even that I want to go into transgender health as a field, because I don't want to have adverse reactions to it.
Okay, that's interesting. And have you had any adverse reactions? Have you had any negative experiences when you say it?
I haven't necessarily had it from doctors that in terms of that they've been like, oh, but I've more had, oh, I want to go into transgender healthcare, and then I've had question after question after question. And as a student, I shouldn't be the one that has to educate everyone on the field that I want to go into.
Yeah.
That's how I feel, at least. Like, I'm happy to do so because I feel like they obviously need some information from someone, but I'm only going to give them information to get them started, and then I'd like them to go away and research it for themselves.
Yeah. Okay. And like around education, how do you feel like we're doing for transgender health? Do you feel like we're doing enough? We're not doing enough, or what directions are we going to take?
This is a really difficult question because I think it depends on where you are within the world, within the UK. So in terms of if you were based in the middle of London, I imagine you'd probably get a lot better education on transgender issues and on transgender health because that's the centre within the UK. It's based in London. Whereas being in a peripheral medical school that's quite far away from it all, that you see lots and lots of different patients, but you might not necessarily see so many gay people or so many trans people. It's quite difficult. So how do you level the field by putting it into the curriculum or having it taught to like F1s, F2s? It's like difficult in terms of that way, at least.
Do we feel like we're taught anything at the moment? Do you feel like, let's say, looking at our colleagues, right? Do you feel like we are currently graduating with enough knowledge and skills to be competent when talking to any patients as well as transgender?
To be completely honest, no, I don't think we are, and that's what I'm kind of trying to campaign currently within the medical school. And so this week is Transgender Awareness Week, so from the 13th to the 19th, and I'm working with the medical school as well as the medical societies to actually get more of this information out there. From my experience now being in my 4th year, I've never had any teaching that included transgender people within it, whether they're patients, doctors, whomever. And I'm sure that a lot of people can agree with me that it's never nice to not be represented within your curriculum.
Yeah, absolutely. So I'm not sure if it's the case, but as a patient yourself, what do you feel like has been your worst healthcare experience, or one of the less pleasant?
It actually happened quite recently. So as I mentioned before, that I'm on hormone treatment. With hormone treatment for transgender people, you've got to be regularly monitored because hormone use in like the opposite sex bodies to that it's usually used to can cause major side effects. So for instance, someone that takes testosterone can actually get something that's called agranulocytosis, and also become and also other things like becoming anemic from taking the hormones if they're not well managed. And unfortunately, mine wasn't managed enough, so I started becoming severely anemic from it. So recently I've gone in, had my blood test done and had all that changed, and now I'm back on to feeling better. But I, through just trying to be myself, had made myself quite ill because I'd just kind of been missed within the system. So that was probably one of my worst things, to be honest.
Okay, yeah. And like, let's go to the third extent, because not everything is negative. What has been your best healthcare encounter or experience?
So when I first went to my GP to say, oh, I'm transgender, I sat there. I was so nervous that I was sweating, I was shaking, I could not say a word. And my doctor literally sat there for me with my in the entire conversation, and this was obviously way before COVID, just put his hand out and let me hold it, and he just went, you can tell me, please don't worry about it. And it sticks with me to the day because he made me feel so at ease. And as soon as I came out of it, he was like, I was thinking that might be it, and I was just laughed at him. I'd known this guy for 6 months. I'd seen him 4 or 5 times, and he'd already been thinking this patient might be coming back to me soon, and it made me feel ecstatic. Is the best way to put it.
That's incredible. I wish we always had those kind of doctors, those kind of healthcare professionals just looking after us. Oh, that's great. So okay, that's positive. That's good to know. So I want to help like to break down some of the misconceptions, some of the myths around it, around transgender health. What do you feel are the top myths, or something which is simply misunderstood by the general population as well as the healthcare professionals?
One of the things that I've definitely felt is that when you tell someone you're transgender, they always assume that you're going to transition into a very wacky and wonderful like image of a person. And so I've had people that assume that I'm going to dye my hair every colour under the sun, and that I'm going to come in and wear like stripy t-shirts all the time, when actually I'm still a normal human being. Like, I'm not changing, I'm just changing my outwardly bodily appearance, or the tone of my voice. And I think a lot of people don't realise that we don't go through a personality change. We're still very much the same person. I think that's probably the biggest myth that I get asked a lot about.
They always expect to go someone wacky, crazy from one accent to the other, isn't it?
Yeah.
Okay.
Very much.
Fair. Anything else that you feel like is a misconception?
A misconception is that it's difficult to describe in terms of a medical context, but I know it's a misconception in general, is that a transgender man such as myself is someone that's still quite feminine and still quite female in the way that they act and portray themselves, as well as a transgender male can still be quite masculine. Transgender female, sorry, can still be quite masculine. And people, I guess it comes down to stereotypes. People still stereotype us to the day, and that's not always fun.
Yeah, and I think one of the things I've seen a lot of friends and colleagues and even healthcare professionals struggle with is always the difference between gender, sex, and sexuality, and how everything changes. Because I've seen colleagues assume that because someone is a transgender man or a transgender woman, then automatically their sexuality will change or will remain the same. So how do you feel like, what have you encountered?
It's really difficult because I've talked to so many healthcare professionals over the last couple of years, and have explained about, oh, I'm transgender, and they always then assume that your sexuality matches that. So I've been assumed so many times that, oh, like, I'm now gay because I'm a man, and they just assume that I still like women, when actually that's not true. I am bi, but that doesn't mean that that's because I'm trans. Or also, people don't seem to realize that intersex people can also be transgender, and when you explain that to someone, they're like, wait, they're not the same thing. You're just like, no. And then you have to go through and educate them about that as well. There's just a lack of knowledge across all these different fields, if you get what I mean.
Oh yeah, absolutely. And in terms of pronouns instead, what's your take on it? And I know we can talk forever on it technically.
No, I'm happy to talk.
Go for it, please.
Like, so gender pronouns, I find that people don't really understand a lot of them, especially if you say to someone, what are your gender pronouns? And if they don't know what a gender pronoun is, they're like, what do you mean? And I'm like, oh, I just assume. So I must admit, I assume people know some of the things that I know, when actually that's not true. So I would assume that someone knew what I meant when I said, oh, what are your gender pronouns? And they're like,
Oh God. Yeah. Awkward silence.
yeah. I think the most difficult one at the minute though is trying to explain what a non-binary person might go by, so like the they them, or even plenty of other gender pronouns as well, that aren't just he him and she her, because there are lots more than just that now. But yeah, it's difficult having to explain people that this patient goes by they them, and then they're like, but why can't they just go by she, they're on a female ward, or why can't they go by he, they're on a male ward? And it's like, no, no. And also, one thing that we see quite a lot is that transgender people will, because the medical professionals don't know where to put them, they don't know whether they'd be suited in a female or a male ward, they'll just put them in a side room.
Yep.
And then they'll isolate them. And personally, I would hate to be isolated because I like chatting too much. I'd want to turn around and the man in the bed next to me and have a conversation. But if they isolate me in a room because I might have different genitals, but actually I am actually the same gender, it becomes quite difficult.
Yeah, and I remember talking to some of the consultants, and they try to have that conversation, which is really awkward whenever happens, and they try to make the decision, well, because they're having a certain procedure where they need to go to urology, which is like to the male ward, or they're going to gynecology or anything like it. And I know it's a tough decision sometimes, but how can we take the patient's wishes, like just the patient into account? How would you go about it?
So there's actually been I don't think it's that new anymore. I think it's maybe a year or two old. Statement released by the NHS that is very long and very wordy, but basically summarising it, it summarises the fact that the patient themselves gets to choose whether they are put onto a male or female ward now, and the NHS agree with that, and have written that in writing. So the only exceptions to that, if a transgender person comes in unconscious, the people that are obviously the healthcare professionals that are dealing with this patient will have to make that decision for them. But as soon as that patient wakes up, they must then have the conversation of, do you feel comfortable in the ward we put you in? Would you like to change? Which can be a really hard conversation, but I think the more that it's done, the easier it will come to.
Absolutely. Do you feel like we're moving in the right direction though?
I definitely think, yeah, slowly and steadily, we are moving in the right direction. I still think there's a lot more to go. But no, we're definitely going in the right direction.
Okay, that's good. This is good to hear, absolutely. Okay, so kind of to finish off, quick question then. What are your top 3 pieces of advice that you would give to healthcare professionals around transgender health?
So my first, and always my first, is how to ask someone their gender pronouns, and it can be as simple as, hi, my name's Will, I go by he, him pronouns, what's your name and what pronouns do you go by? It's as simple as. So that's always my first tip. My second tip is talk to your patient and learn what they do to their own health and how they go about it. So for instance, if they are taking hormones, you need to find out where their hormones are coming from, because if they're not coming from a reliable source, then you need to do something about it. They need to be measured in terms of their bloods and so on and so forth. The last one is just find out a little bit more about transgender health yourself. Like, there is so much out there now. You could Google transgender healthcare and so much would come up. Just to know what the definition of gender dysphoria is would help you when you get around to seeing a transgender patient. You'll be able to understand your patient a lot easier.
Amazing. Okay, and I'm gonna go back to one point that I wanted to touch on. I completely forgot actually. And that's the one where I think people are either very confident with it, and sometimes they fail, they're really successful, they really don't know how to go about it. How would you go about asking a transgender patient about their sexual health? Which I think it really throws a lot of people off, and they don't know how to approach it. So what's your take on it? And like, what are common mistakes, or what could be done better?
having sat there in that seat as the patient and also as the doctor, not necessarily to a transgender patient, but to anyone, taking a sexual history is so awkward, so awkward, and we're just taught that from a young age. The issues that come surrounding a sexual history for a transgender patient is actually the dysphoria that you can cause the patient. So if someone was to say to me, oh, not to be prude, but how is your vagina, would cause me a hell of a lot of dysphoria, because actually I don't call my genitalia that anymore. I don't call my genitalia as that. So it's very difficult. So it can be the same for anyone that's transgender, because they will have their own words that they use to make themselves not feel better, but feel less dysphoric about that area. So all I ever recommend with someone taking a sexual history is listen to what the person's calling their own. And if it's not a professional word, then say genitals or genitalia. Use a broader term than just using the penis, vagina, the testicles, the labia. Use a wider term or listen to what they're telling you. Also, it then comes to examination as well. You might find that transgender patients really don't want a chaperone in the room because they're going to struggle to have just one person do the examination. And I think healthcare professionals don't understand that, because obviously we are now taught that we should have a chaperone for most examinations now, to cover our own backs as well as the patient. But you're going to struggle when you come to a transgender patient with that.
Absolutely. Okay, I've certainly learned something there and then, because I would have not known otherwise. So thank you very much, Will. And like when we were talking before, we were talking about actually about screening, medical screening for all kind of conditions. So how do you incorporate that as well? I think we need to have a different approach in transgender health. What should that approach be?
So I think screening is based on whether at your GP you are registered as a male or a female within the GP system. And that's how your screening program's sent out to you. It's not on like a national database or anything like that. And the GP kind of runs it. So it is very like centrally based in terms of medicine. The issues that come with that, if I was to change my gender from female to male on the system, then when I got to 25, I wouldn't get a cervical smear, even though I've still got a cervix. So I could then be putting myself at risk of not catching a cancer early. So it becomes very difficult. One thing that I probably would recommend is being able to put someone's gender and sex into a system, so that if my sex was in there and my gender, then as long as in my notes I hadn't had a hysterectomy, I would still get sent the screening information, because my sex would still be female, and therefore I would still get sent for a cervical smear or for I don't know, any other thing. So like a transgender female, might not get sent to testicular screening or to bowel screening when actually they really should be.
Okay, that's really interesting. Thank you for the insight. Amazing. Is there anything else you'd like to share with the wider audience or whoever is going to watch this?
Hi. No, I don't really have anything else. Just there is so much going on within this field and so little that people know about it. And I always encourage people just to go and have a little bit of read, because meeting one transgender patient and knowing a little bit about what's going to come out of their mouth is so helpful. And it's the same as if you got a patient that was from a different part of the world and you knew risk factors that they might have from being that part of the world. It's exactly the same as a transgender patient or even someone else from the LGBT spectrum. Definitely. It's just worth knowing a little bit.
Absolutely. I totally agree. Thank you very much, Will. I've learned a lot. I'm really excited. So thank you. And we might have you some point once again, because I totally want to. Thank you very much.